let me quickly introduce myself. My name is Jennifer J. Palumbo. I am a writer. I'm a former stand-up comic, so I'm going to try not to make jokes, but it's probably going to happen. And my first one is that I love that we're talking about tech today, and I have index cards instead of like an iPad, but there you are. My oldest son is autistic. He was diagnosed, believe it or not, at 18 months because I'm an insane, crazy mom, and I fought with the lovely borough of Brooklyn to get him early intervention. And I write about my experiences as a mom. You may have seen my articles in the Today Show, and I also particularly write about hiring neurodivergent employees for Forbes. That's my main, they call it my main beat. So let me ask in the audience, if you don't mind sharing, can you give me a show of hands if you or someone you love is neurodivergent? This is what I'm talking about, people. Yeah. Thank you. This is apparently the first year they've introduced autism to this conference, and I am so excited because that's my way of advocating for my son, because as you may know, there's still a lot of work to be done, and that's something we're going to discuss today. So today's topic is opportunities and challenges for innovative technology in autism care. I love that I wrote down my introduction, like I don't know who I am. But basically, today we're going to explore the needs of autistic individuals, current tools and resources, the roadblocks in accessing them, and how individuals and families can advocate effectively. Also, I do, if you all don't mind, at some point, I do think we should probably acknowledge that there's very little direction in once you have someone diagnosed. I don't know if you all feel the same way. There's like no handbook. They're basically like, this is the diagnosis and good luck to you. So I'm really looking forward to discussing the technology and finding out how to get these resources and guidance. So to my left is Dr. Mike Franz. He is a practicing child and adolescent psychiatrist who runs a weekly neurodevelopmental, I can't believe I got that word right, complexity clinic in addition to his full-time work as the executive medical director of behavioral health for Regents Blue Cross Blue Shield. Thank you for joining us.
Thank you.
My husband's name is Mike, by the way, so I'm a fan. Sarah Batham is here to my right, is the mother of 2 adolescent boys. One is neurodivergent and one is neurotypical, same, by the way. In addition, she is a grant maker at Pivotal Ventures, where she manages a portfolio supporting youth mental health and well-being. Hello, Sarah. I feel like David Letterman. Okay. Christoph Riemann is a co-founder, it's right there in the lovely sweater, and CEO of Juniper Behavioral Health, which automates away admin for behavioral health providers. Thank you, sorry about that. And autism providers in particular. Today, Juniper helps automate admin for providers serving 90,000 kids across the US. That's amazing. Welcome. Also, in case you didn't know, Dr. Cynthia Anderson was supposed to be here today, but she unfortunately is under the weather. So we've secretly replaced Dr. Cynthia Anderson with Robin McIntosh to my left. She's the co-founder and CEO of Avella Health, delivering science-backed, family-centered autism care to support neurodivergent families. Robin's work has been recognized by the New York Times, the Today Show, Harvard Business Review, and JAMA. She's also the proud mom of 2 neurodivergent girls. Okay, this is your panel. So let's get started in talking about understanding the needs of an autistic person. And I love this topic because my son is very speech delayed, and it's really hard to know exactly sometimes what's going on, what he needs, especially when he's having a meltdown and he's in an escalated state. So I wanted to ask, in your experiences, what are some key needs of autistic individuals that are still unmet today, either in diagnosis, daily living, or long-term support? Why don't we start with you, Dr. Franz?
Okay. Well, maybe, so my comments today, some of it's going to be with my provider hat on and some of it with my health plan hat on. And I feel very fortunate that I get to wear both because they both kind of influence each other. And maybe to start with this question, to kind of tell you how I got into having this Friday afternoon neurodevelopmental clinic with a lot of focus on autism, not exclusively, and have a lot of patients that have severe, profound autism, a lot of nonverbal patients as well. And that's because in my community, I'm from Bend, Oregon, in Central Oregon, was realizing in my consultation to primary care, which I do Friday mornings before my clinic, that our pediatricians and family physicians and NPs were managing some of the most complex psychiatric cases that I would ever see in my clinic. And it was largely due because the way that community mental health has been structured is you have to be able to engage in therapy in order to access psychiatric services, which is pretty ridiculous. And some kids can, but some kids can't. So I went to the director of the community mental health program and said, our community has a need. We shouldn't just leave it to these pediatricians to be stuck managing some really challenging cases. And fortunately, they heard me and they allowed me to begin to work in that clinic. And so my comments for the rest of the question really come from that experience and what I'm seeing there. And some of this is, I'm sure, going to resonate. I know people with lived experience and moms and dads and others may have some other things to add, but timely assessments, just getting the diagnosis of autism, I think we all know can take months, if not longer. And then once you do get the assessment, the referral to the providers, whether it is ABA or other speech, OT, other types of intervention, psychiatry, can take another 6 months in some cases. Just what I see in my clinic is the silos between the behavioral health system and the educational system and the IDD system, and in some cases the child welfare system, and it goes on and on, the medical system. And so really trying to bridge that and coordinate that care can be super complex. I can only imagine how it is for a family to try to navigate between that. Just a couple other that I see maybe more specific to a psychiatric autism clinic. I have kids that sometimes are so aggressive or self-injurious that they really need a higher level of care. And the behavioral health system, the psychiatric system, points to the IDD system and says, that's your job. Mm-hmm. And the IDD system points to the psychiatric system and says, no, that's your job. And unfortunately, in our psychiatric units, for the most part, I did have a major breakthrough with a family in unit this year, but for the most part, they say if your IQ is lower than 70 and you have low adaptive scores, you cannot be on our psychiatric milieu because you just won't fit in. I think that's just clearly discriminatory, and we need to get beyond that so that these kids and families can get help and higher levels of care as well. And if we have time later, I can talk about the success case there, but those are just some of my thoughts.
That's great. I know, I really appreciate that. It's an important perspective. And you touched briefly on caregivers. So in terms of, I would say Robin and Sarah, and the three of us, because we're both parents of neurodivergent children, and Sarah, you can start with this. What needs do you think are not being met for caregivers? Both, I guess, and you can approach this both professionally and personally.
Yeah, how much time do you have?
I know, right?
I know every kid is unique, and my kid, he's now 15. He taught himself to read at 3. He memorized the multiplication tables at 4. And after and everyone says, oh yes, those are the special things that autistic kids do. And after that, he just sort of fell off. And every year as he has progressed through school, he's become further and further behind. He's always been very chatty, very social. He knows all the names of the people in our neighborhood. Even people that we don't know their names will walk by and say, his name is Jay. Hi, Jay. And he'll say, hi, so-and-so. And my husband and I look at each other like, do you know who that person is? And it's both delightful and alarming. I think, and I'm sorry, I heard a little bit from Dr. Mike that there was a panel on Tuesday about caregivers and autism. And I'm sorry I missed that. So I'll probably say many of the things that they did, which is we are exhausted. We are trying to care for our neurodiverse kids, and for many of us also our typically developing kids who also don't have enough support. And support, so there's support for us as caregivers, and also support for our kids is support for us too, right? And so trying to manage that whole landscape of care that is very fractured. Seattle Children's Hospital in Seattle, where I'm based, they do a group called SIB shops, which I think has been replicated in some other places around the country, but are are safe spaces for kids of either neurodiverse siblings or siblings with serious medical conditions to just go and talk to each other about what it's like, because it can be fulfilling and rewarding and bring a unique life experience and perspective to be a sibling of these kids, and it also can be really, really challenging. And so for us, we need people.
Right.
We need people who get our kid without us having to explain everything over and over and over again. The idea sometimes of, we joke and say, onboarding someone new to our child is just, the thought of it is so exhausting that we go without. Because even getting to a place where we have someone who we can trust and we know is going to get our kid and not judge us or our kid is really hard and time-consuming. We've had the benefit of the most lovely psychiatrist who's been working with us for probably 10 years now. Telehealth was huge during the pandemic, being able to have time with her still. And she will also say to me on a regular basis, she's like, "Sarah, I can't prescribe for you." But basically, like, you need to get your own support so that you can navigate these challenges. And schools has been a huge savior and an incredible challenge. My son is in a terrific place right now, but it took us years and years and years to get there, and it was really tough for a while. And so schools that can support, who understand, for whom my son is no longer an outlier, which he'd been even in a private school for neurodiverse kids in Seattle, which we were lucky enough to have, was not a good fit for him. But it took us a really long time to get there. I got really good at pitching fits, which I was not necessarily good at before, but have become very good at.
Yeah, I think you have to, because, particularly, again, giving my son as an example, since he's speech delayed, he can't really advocate for himself. And so you have to very often be their voice. Robin, do you have anything you want to add, both from your professional and personal experience?
Sure. Yeah, I think this is a great question, and I love talking about it. I think that, so my background is I was CEO and co-founder of a company called Work at Health, and I see some Work at people in the audience, so I see you. But so with Work at Health, going back, it was 10 years ago that we created Work at Health, and Work at Health is an addiction care program online. And very much in the space of addiction, we are treating the symptom, not the underlying condition, 10 years ago. Now we've grown up, now we're better, but we are treating the symptom, not the condition, right? Like with the underlying drivers of why you drink, use drugs, et cetera, and so on. So what Work It and a bunch of other clinicians did around research, et cetera, is realize it's an inside-out problem and focus on the behavioral health component, the behavioral and the physical pieces, so that the symptoms abate. So then fast forward 10 years later, I have this incredible daughter, starts speaking at 6 months, says no a lot, very bossy. And so her name is Peach, and she probably would have a lot to say about everything I'm saying right now about her. But Peach started talking at 6 months and never flagged for autism, right? So she never flagged. All of the well checks and the pediatrician visits. And actually my second daughter didn't talk and doesn't make eye contact, not autistic. And so we're going, and Peach is 3 years old. She's always been like a raw nerve. And I just thought this was, okay, she's on track to become an alcoholic, eating disorder. We have to surround her with supports. I was like, I've seen this before a million times, family tree, And so anyway, with Peach, she goes to preschool, and she just, it's like self-injurious behavior. She starts cutting herself. She's melting down all the time. She's eloping. She can't handle the stimulation of her social instincts being so different than all of the other kids. So we get her into care, and it's good care. It's very, very good care. Great clinicians. They're focused on fixing her. And I'm kind of sitting here why are we fixing her behaviors? I've worked in addiction and an inside-out model for 10 years, and I'm 18 years sober. And I'm really sober. I'm in deep recovery. My whole world is recovery, and it's really difficult to stay sober and upright on this planet, And I truly believe what I believe. And I'm Peach is a little human. She's not an animal, right? She's a human being. And so with Peach, it was really important to me to understand what her worldview was first, first and then drive outwards from there. And also understanding autism, once I understood it as a brain wiring issue, it's a differently wired brain. That's all it is. It's not a disease. It's not a condition to be cured. It's not a condition to even be treated, right? Like, it's a brain wiring issue. And once you understand that as a parent, you realize, like, we need to change our entire family. There's this great saying in 12-step where it's the only thing that needs to change is everything. And like, that is so effing true in this space. If you know this professionally, personally, and that's why it's so difficult for these one-size-fits-one models, or these, like, you know, this only way is ABA because it's efficacious based on XYZ of behaviors, right? Like, it doesn't matter. Like, the only thing that needs to change is everything. So how can we truly close our eyes, innovate a new model that approaches this as a family system design problem? So we did things like, we, for instance, we basically built a motor playground. My sister's an OT. So she was like, I'm sending you my Amazon list. And so we got this huge trampoline, which is so freaking ugly. But so we have this huge trampoline and Peach bounces it out. We have aerial swings everywhere. And I'm sure the mothers are like, yeah, I do too, you know, swinging children all over the place. And like, you know, we addressed the OT stuff we could do while we were sitting on wait lists. We addressed a lot of the speech stuff. You know, you can jumpstart. You're the expert of your own kid and your own family. But like, she's going to be autistic for the rest of her life, right? And my whole family is probably on the spectrum at some point. Like, you know, I have 2 neurodivergent sisters who were just diagnosed with ADHD. So I really think it's important that we stop focusing in exclusion on fixing the kid, but focus on instead fixing, or for lack of a better term, changing the environment to accommodate an autistic brain, not just anchoring on a neurotypical brain. Right? And then she got better. Like, she's a lot better now. She's thriving, but she's autistic. Right? Like, she has weird behaviors and she has autistic ways of being. I mean, she loves alphabetizing all of my clothes, you know? Like, we color code everything. We love it. We love color coding in my family. But I allow her to be herself and autistic, and her anxiety went away. She doesn't melt down anymore. Right. So I just wanted to say that because I think it's really important to change the conversation a little bit. Like, in addiction we've done it, but in autism I still find it so focused on the child and not the parents.
And it's funny, kind of encapsulating both some points that you made. I shared this story the other day, and I apologize if anyone heard it. So I have a neurodivergent son and a neurotypical son, and I took them both to the pediatrician. And my neurotypical son, who never stops talking, he gets up on the table first, and the doctor's like, oh, what's your favorite subject at school? Do you have any friends? She's like asking him all these questions. And so Matthew gets down, my son Michael gets up, who's autistic. She doesn't even talk to him. She immediately turns to me and says, what's his favorite subject? Does he have any friends? And so I was like, this is a pediatrician. And he does talk. I mean, he's not very verbose, but I was shocked that she didn't even try to engage him. And on the note of healthcare, Christoph, under this umbrella of what we're talking about is where needs aren't being met. From your perspective, healthcare and technology, where do you think we're missing the mark?
No, it's a great question. We take obviously a very back-end approach to healthcare for a couple different reasons. The primary one actually being in a prior life as a consultant, what we really noticed was providers are spending well in excess of 25-30% of their time doing all of these admin tasks related to insurance billing, related to scheduling, related to intake. And so that's where we really are spending our time because, to the point of all the people who have lived experiences here, the process of, finding a provider for your child is an incredibly difficult one. And, we're right now, because of the inadequacy of technology in this space, I really do believe that we make it unnecessarily stressful in a lot of ways. In order to find the right care, right, and that leads to folks spending years and years on wait lists, right? Like there's some places I know where we're actually doing a lot of work on network adequacy right now with a few of the nonprofits in our space, and we just did a map for New York because that's where our company is based, and there's only I think 2 counties in the whole state that are adequate, right? And our whole thesis is actually if you can provide a lot of the automation to free up this 30% of time that providers are spending doing non-care activities, you can actually increase the supply of care substantially and help people get off wait lists a lot faster, right? And help people find the right provider a lot faster. Because, even today, a lot of our providers who are doing scheduling, it takes 4 weeks just for them to find the right match, right, within an organization. And that's a very solvable problem from a technology perspective, not necessarily to say, hey, here's the only provider that's right for you, but hey, just from an availabilities perspective, right, like these are the only 5 providers who have availability today, right? Like that's a very different problem that we can start to solve from technology. And that's really where we spend a lot of our time today, is how do we accelerate the rate of, a parent finding the right, provider for their child in a as everyone on the panel is kind of mentioned, there's so many different types of care, right? And so how do we help them find the right provider for their child in the right type of care for their child, whether that be speech or occupational therapy, physical therapy, ABA, floor time, right? We serve the whole gamut of care here, because I do view that kind of being able to serve all of these different providers to actually help you find the right provider is really important to us.
Yeah, I was wondering as you were talking, I'm like, how accessible are these tools either to healthcare or caregivers?
Yeah.
But, and then I also want to ask you this too, so you're on deck. But in terms of tech, what areas are being met, do you think, in the autism care space?
Are being met?
Are being met. I know that's what we're going to be here for.
It's a good question. I don't know that I have an answer that is not genuinely. I think it's probably none, right? So we spend almost none of our time on the clinical side because we're just not the right people to do it. I really do think there's a problem when folks who don't have clinical backgrounds come in and try to build clinical models. I think there are a lot more clinical startups there in the space, which is great, like to provide better clinical care with folks who are very well informed in the space. But honestly, like today, if we take a look at least all of the back end, like the EHRs aren't meeting the needs, intake software is not meeting the needs. Like I know most large-scale providers are using, Salesforce configurations that have cost them millions of dollars and are still not meeting their needs, right? And I think that's kind of one of the primary reasons we're in this space is I don't view there being any real area where technology is making lives a lot better today. Yeah.
All right, so you all have to start companies after you leave here. There's a gap to be filled. What do you think? And then I swear I'll get you.
So I was really intimidated when I was asked to be on this panel because it's called like technology and autism, right? I'm like, I'm in this community mental health program. It's really just me and these 4 walls. I don't use any technology. What the heck am I going to say? So I found Neil from Cortica, who's been my consultant all week, kind of pointing me in the right direction. But I actually thought more about it, and it's like, hold on. There are a couple things I do. I use Dragon for dictation, which is great, and that frees up my time and allows me to do more clinical work. So there's some technology, been around a while. And there's the EMR. You're right. There's lots of problems with the EMR. We hate the clicks. But I'm very fortunate, again, in my community, the 2 largest pediatric primary care clinics where I consult to in the mornings doing collaborative care and e-consults are on Epic systems. And our community mental health program is big enough in Deschutes County that it's on an Epic system. I can see all the pediatric notes. I can see all the specialty care notes that use the Epic. They can see my notes. HIPAA, let's get rid of that misconstrued privacy rule, which doesn't exist, that you actually can share mental health information without a release of information. That's why Epic is wonderful in this. We don't put ourselves out there as an SUD provider, so we're not covered by 42 CFR. Sorry, I got to say this. So often we won't share information when we actually can and should and need to. So the EMR is very powerful in that regard. I also think just, virtual care, right? It's kind of like technology 1.0 at this point. I've been doing telemedicine since 2007 and have been able to serve Frontier, Oregon. We're not a single psychologist or psychiatrist lives in the entire county that's bigger than the state of Connecticut. And, that's pretty amazing. I do my collaboration with the PCP clinics remotely at home, quite honestly, sitting in my underwear on Friday mornings, but with a shirt on, able to, consult and get a lot done. I mean, it's amazing, right? And super productive. And by doing that, I can help the pediatricians and their teams keep kids in the primary care setting for mild to moderate conditions where they don't have to refer out to specialist care, which is a scarce resource. So from a population health perspective, it's really addressing a lot of the challenges. So that stuff's going really well. And then just quickly, this week, We have a couple of exhibitors here. Again, I was pointed in the right direction. Thank you so much. Florio is a virtual a reality startup company that helps neurodivergent kids kind of tackle challenges, whether it's just some basic interpersonal socialization using these cartoon, if you will, platforms with the VR, or maybe crossing the street safely or navigating, being around a pool. Their most recent one is going through TSA, which I thought was just brilliant, right? So you can do this in vitro before you have to do it in vivo, which is kind of a construct of psychotherapy that now lends itself to the neurodivergent community. And then there's Early Point was another exhibitor, and this took me back to about 10 or 12 years ago. I was at the American Academy of Child Psychiatry meeting, and I walked into one of the conferences they were doing, and up on the wall was the movie in black and white, Who's Afraid of Virginia Woolf, from the 1966 or something. But the fascinating technology that the researchers did were using eye tracking of a control group and then kids with autism. And the kids with autism were generally looking at the doorknob or the chin, whether the neurotypical kids were looking at the eyes, where you can really reference a lot of the emotional content. And that technology is now being used as a device that you can use to track kids' eyes and help make the diagnosis of autism. So those are two examples of really exciting technology.
I have to add one thing, and then I'm all to you. But the TSA, I don't know if you know, they have a program called TSA Cares. Do you all know it? Because I never knew about it. I have a friend who works for the TSA. It is a lifesaver. And I love that hardly anyone knows about it, but I fill it out ahead of time when we're going to fly with my son Michael, because he hates loud sounds. So like if the luggage conveyor goes off, it's a disaster. And as you may be able to tell, I'm from New York. And when we're at JFK and the TSA is like yelling at my son, he's like, put your back into, like he's like overwhelmed. They have a representative from the TSA to be like, yo, like, he's autistic, slow your roll. And that's exactly what the woman did. It's a great program, so I recommend it. Robin.
I love that you brought that up, because someone just told me about that. Another mom, of
feel like a lot
course.
of
My
people don't know
provider
about
did
it.
not tell me anything. We went to Disney for the first time. Oh my goodness, that was an exploration into Dark Night of the Soul. But, Peach says she's never going back. Like, she was like, I'm never going back to that horrible place. But she's 5 now. But so anyway, but I love this topic, and I'm so sorry that you guys couldn't all see Dr. Cynthia Anderson, my co-founder, because she could have talked really well about like the clinical piece. But technology is something that I'm really passionate about, and virtual care, right? Like, because I think virtual care, we often think about it in terms of telehealth and putting someone on Zoom, right? And like what happened in COVID, but it often addresses marginalized populations better than in-person care. And so I think with a good example, actually, I have 2 thoughts, but like a good example actually is it's not even marginalized population. So in our family, we're a double income family. Both my partner and I work. My kids are in school, in preschool and nanny. They're both in daycare from like 7:30 a.m. to 6 p.m. a long time. And because I work really hard, I work a lot, and so does my husband. And so Peach needs a lot of help, right? So she had 30 hours a week of ABA. We quickly got out of that, and then she was given OT, and so the OT provider wanted us to come to across the bridges, right? So from Lafayette, where I am, which is 50 minutes to drive over to Marin, which is their OT space, 3 times a week. And I was like, I can't do that. There's no way that I'll be able to do that. Like, Peach will barely get in the car. Does anyone else try to put neurodivergent kids in cars? Like, it is really difficult to put them in cars for a long period of time. So it's just a great, we think about virtual care and we think about rural access and last mile issues, but we don't often just think that's a parent's life. And that's, this is a chronic condition. You have to help someone like Beach or me or whoever for the rest of her life, right? These are really inconvenient things for families. So we talk so much in technology about back end. And I want to see what you see. And I ask my providers all the time to see all the information. And then I say, it's illegal not to give it to me. And I don't know if that's true, but I do say that. But I want to see what you see sans the underwear thing. You know, like I really.
You don't see the end. That's the beauty of it.
Yeah, that's the beauty of it. That's the beauty. But I want to see what you see, but I don't. Because so often in technology, we work on the back end. We solve things that are problems for us as providers, clinicians, and practices. We don't have product and design teams that like Instagram has and TikTok and whoever. Like, I love Juniper for this actually, but we don't have product and design, and I'm a designer, you can probably tell because I'm like getting really hot and heavy, but like, you know, we don't have design teams that think through with meticulous precision the parent journey, the kid's journey, the family's journey, the sibling journey. We have sibling groups at Avela Health. Of course we do. Obviously. We have dads groups where we just train the dads on things called alignment. You know, like the dads just get in the way. And so we put them in their own cordoned off group. We call that the dads group. And they love it, right? Because they're tired of getting in the way. Everyone wants to do better. So we think a lot. We do evening hours. So we don't do our pediatrician appointments in the middle of the freaking day. We do it in the evening, and we do it in the early morning, right? Like when people are getting ready for work, and then the families enter the picture, and like siblings are there, and nannies are there, and grandparents are there, so we see the whole picture. But I think it's really critical to stop this like back end, constant looking at how our lives can be rich with data and better, and start really shifting the focus at least a little bit to the front end experiences. Because the Zoom link is not enough. It's just not enough. We need to be so much smarter.
And this leads me into my next question, which I want to ask both of you. What are facilitators or enablers, do you think, that they should consider, I guess, when they're designing and delivering tech-based services? Sarah, why don't we start with you?
Yeah, great question. And I was thinking this last bit of conversation too about systems that help schools and healthcare providers talk to each other. I know there are different laws and regulations on either side, and that's difficult for all kids, not just our kids. But the amount of paperwork, like anything that helps minimize the amount of paperwork I have to fill out, also because they're all just like slightly different questions, and especially the open-ended ones of like anything else we should know about your child, and I'm like, oh my God. But so because there's so many things that you have to sign of like, yes, I want this specific person to be able to talk to this specific person and vice versa, and I have to sign that. And I want this organization to be able to talk to this organization, and I have to sign that. And then I'll have thought, okay, I've got my bases covered, and they're like, no, sorry, we couldn't invite your psychiatrist to the IEP meeting because we didn't have this piece of paperwork. And it's exhausting. Mm-hmm. And I'm totally forgetting what your actual question was.
No, I do that all the time. Basically, what do you think people who are developing these technologies are missing that they should factor in?
I mean, exactly, I think what Robin said, which is ultimately what is the caregiver experience, and how much the time that
to make things more efficient, I think, probably.
To make things, to smooth things, to be like, you only have to do this once, and you don't have to do it, you know, in these 10 other places, to be able to just understand what you need to do in the first place. Like, especially if you're new to this, when somebody was saying at the beginning, maybe it was you, Jennifer, about you get a diagnosis and then you feel like you're just completely adrift on a sea of information, half of which is probably garbage, and the other half is like, some of it is really valuable, but like you don't know where to start. And so where is that handbook of like even just the trusted resources of like, here's what you should know about ABA? Because that's also another thing of like, this is the thing that you are told that you need for your kid.
Side note, whenever I write a Forbes article, I purposefully never mention ABA because anytime I do, I get slew of emails from the autistic community. But like some of the experts I interview, they'll mention it and I purposefully edit it out. I'm just like, because that's the other thing. You're not only trying to find resources, but then some of the resources are controversial. Yeah. And they're like, oh no, don't go to that group, go to this group.
But where else do you go? But then there's no alternative. And we've actually found, so we did ABA for a few years when my son was young, and it was helpful in some things. But again, to your point, Robin, it's like, you know what, everything else just needs to change because my kid is who he is. But we've also found some of the best and most delightful and loving and supportive people through those agencies.
Right.
We also were completely cut off once COVID started. Of like, we'd
Yes.
been with this group for years, and they said, we're no longer serving families in Seattle. Your child has been discharged. Period. End of sentence. So we lost a ton of support.
Yeah.
But like just figuring out, like actually talking to caregivers about what do you spend all your time doing when you know you should actually be spending time jumping on the trampoline with your kids.
Right.
And I do.
I want to make sure we leave time for Q&A, but I want to make sure I give you a chance. Is there any way you think technology could solve for these or make things more efficient?
I think that's a really interesting question, which is like, in our view, I think technology is a really helpful tool, but at the end of the day, I think where we made a lot of mistakes at the beginning is like, most of these problems are incentives problems in healthcare at the end of the day, and building technology to try and solve that, in and of itself, without taking that into account, doesn't end up solving the underlying issue.
That's a good point.
A good example is we actually started like 4 years ago as a tool to help providers communicate with caregivers more easily in a HIPAA-compliant fashion, and we grew very, very quickly in the first kind of 6 months, and then all of a sudden, people started churning very quickly. Like providers weren't paying for the service anymore. They started discontinuing, and we started, doing a lot more interviews. And the realization was actually because providers weren't getting paid for that time, they didn't want to be more accessible. They signed up at the beginning and paid for these tools because they wanted to, do the right thing for their parents. But at the end of the day, what that was creating was a lot more stress for them, and they weren't actually able to help the caregivers in the ways that they wanted. And so that was like a real realization for us, is like, yeah, you can build this technology. It's a lot of this technology is relatively simple to build, but if you're not building it with the broader context in mind of the incentives in the healthcare system, it ends up falling apart very quickly. Yeah.
Because what providers get paid for is huge.
Yeah.
Right?
I don't know if this is depressing or inspiration.
It's a mix.
I know, yeah, it's a little bit of both. So I have a question here. Any advice for someone that is overwhelmed with a child newly diagnosed as neurodivergent? The next steps list is hard to manage as the primary caregiver. Let me just say something really quick. I had a conversation with, I don't know who it was, but they were like, so what are you doing for support as a parent? I said, oh, well, my son has OT, PT, and I started listing all the things they had, and they're like, no, I'm not asking about your son, I'm asking about you. I'm like, nothing. I got nothing. And there really isn't much. So does anyone want to?
I'd love to take this question, because this is so fresh for me. Peach was diagnosed at 3 and I had nobody. And you're right. You get this diagnosis and then you're told ABA is the only answer, otherwise you're fucked, excuse my
And you're a
language.
bad parent if you don't
I know,
do it.
and you're terrible. Like you're just a POS or whatever the kids say now. But I'm trying to tailor my language or whatever. But, you feel like a horrible parent. And then you feel like you really do. And so, the biggest thing, again, I'm 18 years sober, got sober through 12 steps. So a lot of why I'm still living is reliant on the social model of medicine, right? Like the idea of one alcoholic talking to another alcoholic. It's a simple idea. Because yes, I had great therapy, I had great CBT, I had great psychiatry, which was even more important for me. But then I surrounded myself when I was young, in my early 20s, with a network and a community of people in recovery. So the first thing I did, being someone who's a proud, sober woman, is I called my really close friend, Liz, and I said, can you make me a 12-step group of mothers with autistic kids? And this is in Northern California. You throw a rock and you hit someone. I didn't know anyone. So I was on this real island, and I was so embarrassed to tell anyone that I had missed it, too. That's this shame. And she was 3, and I was like, oh, I'm the worst, she could have been doing this and that. And then you look up all the early intervention stuff and you're like, oh my God, she's gonna, never walk out of our house again. It's doomsday. So Liz, by that night, she gets texted all the time, right? She is in the same program I'm in, but by that night, she had arranged 8 different women to meet once a week. And these are all women with older autistic children. They didn't have to. Once a week on Wednesdays. We called it our Allura Pod, which is our prior name of our company, but now it's Avela. We don't have to get into that. But and we talked. And I learned things like a regional center. And I learned things like an IEP. And I learned things like a motor playground. And it was just this amazing tribal community lift, and it existed, right? And like we talked about how sometimes we don't want to be parents, and sometimes we're so disappointed, and like all of the grief and all of the processing, and how disappointed we are in our partners, and how much we love them, but also it'd be easier if they just left for a while, you know, like just things like that. And it was just this unbelievable unlock for us. So I would say to the person, I really would get yourself some friends, and if you don't, email me, and I will do the same for you. Like at Avela Health, we do that.
Someone also commented here, I'm just looking, it says, how do we get parents to understand that help is out there, especially if providers don't pay for it? I think the biggest thing is finding other parents who are going through it.
That's what I'm saying, yeah.
Yeah, which it sounds, right, exactly like what you're recommending, and for me, that's been a huge help. Please.
I'm sitting here and
Exploding.
excruciating pain, knowing how bad of a job I've done marketing.
Aw.
So everything that you guys are saying is either in our product or in our pipeline over the next 3 months.
Marketing is hard.
And the issue, and the company's undivided, and the issue.
Oh, I love Undivided.
Is how do we get providers to prescribe in a way
Right.
services like this when they're not getting paid for it? And the marketing challenge we have is that no parent of an autistic child or a child with disabilities meets any form or fashion, right? They're all over the map. So marketing to those parents is really difficult. Marketing to providers is easier, but they don't have the time or get paid to prescribe or recommend services to parents. And how do we break through that?
I love Undivided. I mean, it's in California, but Undivided was a wonderful thing. I think the only gap was care. And so for me, I was needing a different care model, but Undivided's awesome. You did not do a bad job marketing. I knew about it pretty quick.
And I have one more question. What is the responsibility of insurance companies and payers to support caregivers of neurodiverse kids? I will say this, I always worked in an office until the last couple of years. So Michael's 12, but I now work from home when we had to try to get him to kindergarten because it was a complete mess. So the only reason I actually work from home is to take care of Michael. Because sometimes like the school will call and say, oh, he's having a meltdown, or it's weird to me because I miss humans, which is why I'm here. But I think it's a really fair question because it's not just supporting a child, it's supporting the caregiver to support the child. So does anyone have any insight on that? Getting insurance companies? Oh, God.
Since I'm the health plan up here,
Yes, I was kind of looking at you, but I didn't want to
say something. So I think most people know core services are covered. These diagnoses are covered. There's great variability in accessing some of the core services. I'll just share like what we just learned in the past year from our financial analytics, which was really profound. I think there's some misallocation of the total healthcare dollar in this space, and ABA can be really helpful for some people, but as people on this panel have said, people on the previous panel on Tuesday said, there is tremendous variability in the quality of ABA, often used inappropriately, very little evidence base above age 11, even less above 15. And so not everybody needs 25 to 40 hours of ABA a week, to the extent that now that our pediatric population at our health plan that has an autism diagnosis has a total greater spend for behavioral health than our pediatric population with anxiety and depression combined, and almost all of that is on ABA.
Wow, I didn't know that.
We weren't managing it. This is before I got there, so we're changing our we're PAing it, but it's about quality. It's about the spend, but it's also about quality because we want to lay eyes on the clinical documentation to make sure that this is really appropriate. And if we can take some savings there and then figure out how to do a value-based agreement with someone, right? A lot of talks
I'm
on
right
that,
here.
that can provide. What's that?
I said I'm right here.
Yeah, the challenge is mostly on us,
just kidding.
right? The infrastructure, being able to stand it up. But that's what's obviously needed to put together the services you offer, the services Undivided offer, the services Cortica offers, some of these novel technologies. You guys take the risk, work together, and we'll measure outcomes, we'll decrease costs of care, everybody wins. So that's kind of my perspective.
We're at the end. There is one last question, so I'm going to ask you to do something kind of impossible in like 1 or 2 words. This is the last question. If you had a blank slate with funding, clinical, and technical resources, what is the biggest problem you think could be helped by tech in autism space that incorporates everything you have discussed? Dear God, that's a question. So I don't know if you can give me, like, each of us, we could do 1 or 2 words. Let me know if you need a second. I'll say, for me, I just think kind of the thing that seems to be the theme is there are probably resources out there, but nobody knows where they are. So there has to be, I think, some sort of streamlined process, hopefully through tech, to be like, this is your journey, this is what you need to know. Get a pediatrician, get this, get that, because there is no roadmap at all. So if there was some app or tech to me that's like, this is what you need to get started with, or have a checklist, that would be helpful. But let's go down the line. 1 or 2 words or less. You can do it. You can do it.
This is hard. I would say, actually, to bridge on yours, I would say design, right? And I know that I'm a designer, but Undivided is a good example of something that was so obviously designed by a parent of a neurodivergent kid.
Right.
There's one login. You log in, and everything is fitting your flow. And that's good design, right? It's not that there's a lack of availability or even problems finding resources, et cetera. It's that no one is taking the time to resource designers and to resource clinicians as designers and plans as designers and like rethink. Like, we just keep powering the same garbage over and over and over and the same models over and over and over. But no one's taking a second to rethink. And so I think it's really important and it's critical with this rising autism rate. So we've been working with health plans all year. All we've done all year is work to do a value-based design that's a low threshold intervention as an alternative to ABA, an alternative to center-based care. We refer out, we care escalate all the time. So we care escalate to Cortica all the time. I love Cortica. And positive development if people want developmental. Those are my 2, ones that I think about a lot. But I think it's really important to understand the design on the front end needs to change, and it takes time and work and research and ethnographic, and that's just a fancy word of saying talking to people. Right. And listening to people and making those listening findings actionable, right? And doing something about it. And then I would say the last thing is attunement, and which is just the same thing. So it's just the same thing.
Rethinking.
I just like that name.
Yes.
I like that word better. But I think an attunement needs to happen.
Okay. Dr. Franz.
Very much a health plan answer here, but I think getting to VBAs is the rate limiting step. I mean, it's all over the conference. It was the same discussion last year. This is on the health plans. We just have a really hard time setting up the infrastructure, the reporting, the reconciliation. If there's technology that can come along to help this, because man, we are having a hard time figuring it out, so that we conquer that, I think we've got a total game changer.
That's great. Sarah?
Yeah, I don't know. Mine is so much technology-based, but I think about all of these different opportunities and support that help caregivers figure out what it is that they need. Often at the end of the day, for us, it's like we need more, as I said earlier, we need more people to be able to support our son and our family, and we can use whatever it is that we're supposed to use. And I have excellent insurance and have a lot of health advocacy, health tools that I can use. But at the end of the day, when it's like, okay, we need to find this person, finding that person is practically impossible because there just aren't that many of them. So it's also part of the workforce issue. And if it's not ABA, then who are these people and where are they and can they get paid? Because when it comes down to hiring the person is often not there.
All right, Christoph, it's down to you.
No, I would actually really agree with Mike here in terms of VBA and VBC being a primary kind of lever that we can pull here around things. I mean, there have been some small pilots around supporting parents, and that has led to way lower cost for the health plan, while also leading to much better outcomes for across the board. And so, how do we actually create mechanisms to measure that, right? Because if you can measure that, I think it's a no-brainer, honestly, right? Everyone wants better outcomes for less money, right? And so it's creating something around that, and that's what leaves me really excited around the amount of investment in technology here today. Like I mentioned clinical tools earlier. I think that it is really, really cool just to see how much more funding clinical tools that are trying to be more objective around quality of care. That's the thing we at Juniper talk about all the time. We're just here to enable quality of care, right? And I think that's ultimately what gets me excited. Yeah.
That's a nice note to end on. Excited. All of these people are online, LinkedIn. Please seek them out. And I really want to thank each and every one of you for attending this one, because this was fascinating to me and very educational. So thank you, everyone.